Today we'll be taking a look at the nervous system. We'll be looking at the various components of the nervous system, the structure of a neuron, of course, word parts and terminology as always, disorders that pop up in the nervous system, abbreviations that are occasionally used, and some medical terms and case studies. Overall view, the nervous system controls body functions with electrical and chemical impulses. They is the thing that is mainly responsible for controlling homeostasis in the body. It consists of sensory receptors, the spinal cord, the brain, and the nerves. It's organized into the central nervous system, or CNS, and the peripheral nervous system, or PNS. CNS is comprised of the brain and the spinal cord, and the peripheral nervous system is basically everything outside of that, the nerves and the nervous tissue in the body. And within that, there is the somatic nervous system that is controlling the voluntary skeletal muscles of the body, and the autonomic nervous system, which responds automatically to stress, and back to that word homeostasis, controlled by the autonomic nervous system. And when we're talking about smooth muscle and cardiac or heart muscle. Within the autonomic nervous system, you have the sympathetic, which is the stimulatory or fight or flight response, and the parasympathetic, which is rest and digest. Fight or flight with the sympathetic, and rest and digest in the parasympathetic. So let's look at primarily the central nervous system here, with the brain and the spinal cord. And coming out of the spinal cord, you have cranial nerves and spinal nerves. If we drill down a little further, the functional unit of the nervous system is a nerve cell called a neuron. There are two fibers involved in a neuron. There is the dendrite that carries impulses toward the neuron, and the axon, which carries impulses away. And the neurons are very long. They're like the superhighways that signals are carried along. And we'll see this word myelin associated with coding the axons for carrying impulses away from the neuron's body and down to its terminus. There are three types of neurons. There are sensory neurons that, as you could probably figure out by looking at the terminology, there are impulses going towards the central nervous system. They're bringing sensory information towards the central nervous system. Motor neurons, which take impulses away from the central nervous system. So away from the spinal column and the brain and to the skeletal muscles and other muscles in the peripheral nervous system. And then if you're not a sensory going towards or a motor going away, you have interneurons that connect these two types of cells. And the synapse is the point where neurons come together. So here's a neuron. And we were talking about the dendrites, which is bringing information from these endings into the body of the neuron. And then these thick arrows going down the axon to the terminus where it comes in contact with a muscle. So information is going to the dendrites, down an axon, Not a very good arrow there. And then down to the muscle, either smooth or skeletal, or cardiac actually, where that information can be transmitted and cause the muscle to contract or relax. And here we have myelin, which is covering the axon, and you can think of myelin as the insulator of the axon. It both protects the nerve cell and helps signals move more quickly along. You can basically bounce from, you can see a node where there's little indentations in the myelin sheath. You can basically bounce from node to node without having to go through the intervening tissue. So nerves are the next up in the structure. It is a bunch of neurons put together in the peripheral nervous system. A ganglion is when you have a bunch of cell bodies all coming together. So here are the roots that we'll be looking at. Glia, you're talking about nervous tissue, and ganglion, as we just saw. Meninges we will be covering, which is a covering. Lallia is speech. An example would be coprolalia, which is compulsive use of obscene words. And here we see, I probably recognize Brady for slow, and Lexia for reading, so slow reading. And we have some more suffixes. So let's move back into the central nervous system. So the brain is a nervous tissue inside the cranial cavity. It is covered by membranes, fluid, and the bones. There are the three parts: the cerebrum, the diencephalon, the brainstem, and the cerebellum. Let's take a look at those. First of all, let's look at the cerebrum. It is the largest part of the brain. It is mostly white matter. Now, when you see white matter, you are talking about lots of the myelin sheathing that we're talking about. So the nerve pulses can move much more quickly through the white matter. And the cerebral cortex is the outer layer. And this is where we have our higher brain functions, our personalities, and controlling our emotions, thinking, those types of things. There are two hemispheres. There's a deep groove between the two hemispheres, which is called the longitudinal fissure, separating the cerebral cortex into right and left halves. So look, we have a sagittal plane section of the brain cutting in half. There is the cerebrum. So we've seen the thalamus, hypothalamus, and pituitary gland when we were studying the endocrine system earlier. And that makes up, of course, the diencephalon. And the brainstem, we have the midbrain, the pons, and the medulla oblongata. This is a more primitive part of the brain, and the cerebrum was a later addition in our evolutionary biology. And in the back, we have the cerebellum as opposed to the cerebrum. So let's take a closer look at the diencephalon. In the diencephalon, you have the thalamus, hypothalamus, and pituitary gland. So thalamus gets that sensory information, impulses coming in through sensory nerves, and then it is a switchboard that will send that information to parts of the cortex that are necessary to process that particular information. The hypothalamus controls the pituitary gland, and it is a link. Here is a link between the endocrine and nervous systems. So there's an interplay of those two systems in the hypothalamus. The hypothalamus will get stimulation and then control large aspects of the endocrine system via its control of the pituitary gland. Now the brainstem, like we saw, there is the midbrain, which is heavily involved in acute vision and hearing. And the pons, which is another switch to get information to the right areas of the brain. We have the medulla oblongata, close to the base of the brain. And everything that comes into or out of the brain has to go through the medulla oblongata. And it will control such involuntary things as heart rate, respiration, and blood pressure. The next structure towards the back of the head is the cerebellum, that is underneath and posterior a bit to the cerebrum, and it is behind the pons and medulla. And this is the structure that will control voluntary muscle movements, your posture, your coordination, and your balance. So when you see people who are ballerinas or gymnasts, those type of people have very highly developed cerebellums to coordinate and balance, and it occurs at a much deeper level than the cerebrum. You don't have to think about it anymore once those neural pathways are ingrained. So protect the brain. First of all, we have cerebrospinal fluid. There are 4 ventricles inside the brain that will make the fluid. And we have 3 layers of meninges that cover the brain. There's the dura mater, which is the outermost layer. The arachnoid, that has a, if you remember, arachnoid, if you are familiar with spiders, arachnoid is the root for arachnid, so the spider web-like middle layer is the arachnoid layer. And then on the inside, next to the nervous tissue, we have the pia mater, and that is where the vessels are to bring nutrition to the brain and get waste matter out. On the outside of the brain, we can look at the frontal lobe above the eyes, the parietal lobe, which is just above the temples, and the temporal lobe, which is immediately underneath the temples, and the occipital, all the way in the back. And then outside, we can see those structures we were just looking at. The pons, medulla, there's the cerebellum underneath the cerebrum, and then the spinal cord heading down to send spinal cords out into the peripheral nervous system. There are some more roots. If you have any questions about how to pronounce the words that I've been saying, or how to put together roots, prefixes, and suffixes. When you think of somnolence, you're looking at sleep. The spinal cord links the peripheral nervous system in the brain, and all the information goes up and down the spinal cord from the body to the CNS and from the CNS out to the body, and is protected by vertebrae, your vertebral column. Spinal cord starts at the medulla oblongata between the first and goes all the way down to the lumbar vertebrae. There is gray matter on the inside of the spinal column, and there is a white matter on the outside. And that is where the ascending and descending tracts that are myelinated and carrying that information rapidly up and down the spinal cord is in the white matter on the outside of the spinal column. In the middle, there is a canal with cerebrospinal fluid once again. So here is the spinal cord, the brain, brainstem, with the spinal column start directly below the brainstem and running all the way down to the lumbar nerves L1 through 5. So let's look at a cross-section of the spinal column. We have gray matter on the inside. We have ganglion on the outside coming out. And then we have a gray cross-section in the middle, with the white matter with the tracks running up and down the spinal cord. There are 31 pairs of spinal nerves, 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. There are 2 roots that go into the spinal column. Up and down the spinal column, there's the dorsal, which carry impulses into the spinal cord in the back, and the ventral or anterior carries impulses from the spinal cord out into the skeletal cardiac muscle or gland. The autonomic nervous system has the sympathetic and parasympathetic systems. Sympathetic, as we mentioned, was fight or flight, and parasympathetic is in ascendance when a person is resting and digesting. So let's take a look at sympathetic nervous system, or fight or flight. Heart rate increases. Respiration rate also increases. The adrenal gland, if you remember that, on top of the kidneys becomes stimulated and releases epinephrine. And all of these work in conjunction to get more blood flow to the skeletal muscles so you can fight or flee. And the parasympathetic system takes over when you're getting the body calmed down back into the steady state and want to maintain and rebuild. And most organs have both sympathetic and parasympathetic activities, and they will work together appropriately to the effects that the stimuli that are coming into the body, so that a person can react appropriately to a given situation. Here are some more key terms. Let me see, when you see gray matter, that is the unmyelinated part of the nervous system. So there are vascular disorders of the nervous system. So look at stroke, also known as a cerebrovascular accident, or CVA. When a blood vessel that is bringing oxygen and glucose to the brain is blocked, it can cause tissue death. and paralysis. Risk factors are high blood pressures, atherosclerosis, heart disease, diabetes, as we've studied, cigarettes again, and there is a hereditary link to predisposing people to cerebrovascular accidents. As a person ages, the brain will decrease in size and weight just through cells being lost. Information at the same time will be processed more slowly in general, but this is also varies very much between person to person how much their brain tissue shrinks and how much their cognition is impaired as they get older. So some disorders of the nervous system are thrombosis, aneurysm, seizures, other degenerative diseases such as Parkinsonianism and Alzheimer's disease. You can have trauma to the central nervous system, of course infections, cancers, and behavioral/psychiatric disorders. Let's look at thrombosis. This is a blood clot. Oftentimes the carotid artery, if you remember, that is the one that is feeding blood up into the head. And you can go in and cut out the thrombosis with an endarterectomy, and also use drugs like heparin to dissolve the clot, and also aspirin will interfere with clotting as well. An aneurysm is a dilation of a blood vessel in the central nervous system. That dilation can rupture and hemorrhage. Oftentimes people are born with these weaknesses in their brain, and atherosclerosis can predispose people to aneurysm as well as hypertension. And depending on what part of the brain is affected, it can lead to aphasia or trouble speaking, or hemiplegia, or half of the body being paralyzed, depending on if the aneurysm is in the left or right half of the brain. So there's a picture of an aneurysm that has not ruptured yet. But if this area does rupture, then you will end up with a hemorrhaging into cranial tissue. If there is trauma, there can be a bruise on the brain and bleeding between the dura mater, remember the tough outer layer, and the skull. So it's not actually on the tissue, but it can certainly swell enough that there can be pressure on the nervous tissue. There can be subdural hematomas, and that is between the dura mater and the arachnoid. If you remember, the outside and the middle layers. And that is usually when the back of the head is struck. Now, concussion is from trauma to the head. And we'll go into what a contre-coup injury is. That's basically when the injury is on the opposite side of the brain where the trauma occurs because of the way the brain, for lack of a better word, sloshes around inside of the skull when it undergoes trauma. So we have an epidural hematoma on the outside between the dura mater and the skull. We have a subdural hematoma underneath the dura mater in the subarachnoid space. And there can also be hematomas deep in the brain tissue itself. I think we all know what confusion is, so I'm not going to go over that slide. Coma is when a person cannot be aroused. Infections that can occur in the nervous system is meningitis and there is bacterial meningitis. If a person gets a stiff neck, that is often a calling card for bacterial meningitis. And you can put a needle into the cerebrospinal fluid, withdraw some of that, and see if there is a causative organism in that fluid. You can also contract viral meningitis, which can cause encephalitis or inflammation of the brain. Some of the things that can cause viral meningitis, this is certainly not a complete list, but poliovirus, HIV virus, and rabies will all cause encephalitis if left untreated. Now, shingles is when the chickenpox, or HSV, herpes zoster, will stay in a nerve, peripheral nerve, and when a person gets older or their immune system becomes otherwise compromised, this virus that has been controlled can proliferate and cause extreme pain along those nerves specifically that they have been hibernating in. So cancer of the nervous system is called a neuroglia. A meningioma is a tumor in the meninges. Remember the dura, pia, and arachnoid meninges. Under degenerative diseases, we'll start with multiple sclerosis, or MS. That's when that myelin we were talking about in the white matter starts disintegrating. And when the myelin disintegrates, impulses aren't set as efficiently. Don't know what causes it, but tingling and numbness is one of the first things that often occur. More degenerative diseases, such as Parkinsonism or Parkinson's disease, that's in the midbrain, doesn't make dopamine. If you remember where the midbrain is. And you can treat that with oral L-Dopa to replace the dopamine that has been lost, especially in the early going of the disease. But there becomes a point where adding more L-Dopa doesn't really help the Parkinson's. Another degenerative disease is Alzheimer's. We don't know what causes Alzheimer's at this time, and there isn't a way to definitively diagnose it until a person dies and a lab will take a look and look for tangles in the cortex. There is multi-infarct dementia, which is many mini strokes gradually kill and damage brain tissue, and will often be indistinguishable from Alzheimer's disease. Like I said, the only way you can diagnose Alzheimer's disease is post-mortem. In epilepsy, seizures can be petite or small mal and grand mal, which are the big full body seizures. You can diagnose them with taking a look at brain conductivity with an EEG, electroencephalograph. They can be treated oftentimes, most times, with anti-antheleptic drugs, and if a person does go into a convulsion, they can give anticonvulsive drugs to control how extreme the convulsion is. Dys, remember that prefix, somnia, is when your sleeping pattern is disturbed. It can be insomnia, which we all suffer from time to time. There's narcolepsy, when a person uncontrollably can't stay awake and falls asleep, even if they're doing something that requires their attention, like driving, for instance. There are stimulants that will certainly help with narcolepsy. A person with narcolepsy has to be very militant about having good sleep habits so they're fully rested. That lowers the barrier for these attacks. And naps will certainly help control narcolepsy as well as a preventative. When a person has apnea, they quit breathing while they are sleeping, and that's usually from an obstruction, and you can get a PAP or positive airway pressure machine to help keep those airways open. And certainly weight loss will help if a person is overweight. So polysomnography is when you put an EEG on a person's head and see what their brainwave activity is like as they're sleeping. There's the deep sleep, or non-REM, non-rapid eye movement, and the rapid eye movement when you're dreaming. That is the REM sleep. In behavioral disorders, there are anxiety disorders. The most common is generalized anxiety disorder, and that is when there is chronic worry. Of course, there is muscle tension that goes along with this, restlessness, dyspnea, palpitations, insomnia, and irritability. A panic disorder differs from a generalized anxiety disorder because it is very intense and it is episodic rather than chronic. A person can develop phobias. There is OCD, where a person controls mood states with repetitive behaviors or rituals that help relieve their anxiety. And there's post-traumatic stress disorder. And often there are follow-up emotional problems with PTSD. Depression is a chronic feeling of sadness, generally lasting more than 2 weeks, hopelessness, and lack of interest. And as healthcare providers in Washington, you will most likely need, well, those of you who will be dealing with humans anyway, need to take a class to recognize the signs of depression and be able to refer people. Now there's dysthymia. That is caused by a serious event. Oftentimes, generalized depression isn't caused by anything in particular, and that sets it in opposition to dysthymia that does seem to have a cause. And bipolar is when a person is both, has episodes when they're depressed and episodes when they're very manic, can't sleep, have insomnia, and partake in a lot of fruitless activity. In psychosis, a person can have delusions, paranoia, and hallucinations. And the chronic form of psychosis is schizophrenia. In ADHD, or attention deficit hyperactivity disorder, this generally happens, is first diagnosed in childhood. There is psychotherapy and behavioral therapy, and certainly a lot of drugs, such in the Ritalin or stimulative class, since people with diagnosed ADHD react with a calming effect when they take stimulants. No one really knows why, but that is what happens. In autism, we're talking about an effect on social interactions, and they can be normal intelligence, and can even, in some cases, develop very unusual skills. In fact, I was just watching a documentary about a couple of female twins who are called savants, and they can remember mountains of information. Like they could just give them a date of anywhere, and they can tell you what day of the week it was. Like, November 11th, 1938, and they can tell you immediately what day of the week that is, amongst other things. But it's a fascinating disorder. So with autism, they have a hard time looking outside of themselves, have a hard time with social contact oftentimes. It'll be their fight or flight response kicks in too easily oftentimes, and it can be self-destructive to try to control and bring their anxiety levels down. In Autism Spectrum Disorder, this is when we're talking about the high-functioning autism. So I was talking about the savants. They can still have a little trouble with social interactions. And they will also try to control their emotional states with repetitive OCD-type behaviors. And they get very interested in specific things and know everything about whatever it is that they happen to be interested in. We're talking about psychotropic drugs. There are drugs that affect the central nervous system and thinking. There's anti-anxiety or anxiolytics, mood stabilizers, antidepressants, and antipsychotics or neuroleptics. Key terms. Let's see that we hit these. Alzheimer's. Amyloid. We're talking about Alzheimer's and those tangles. Post-mortem, these amyloid plaques will show up in the brain of people who had Alzheimer's. And we didn't talk what astrocytes were, but they are a specific nerve cell. And if there is a neuroma of the astrocytes, it is usually a very serious diagnosis. Okay, we talked about contracoup, damage to the brain on the side opposite of the point of impact, and that, like, you get hit in the front of the head, then the back of the head can bounce off the skull, and that's where the primary injury will happen. You can have hydrocephalus, or water accumulating, fluid accumulating in the brain. Multi-infarct dementia from multiple small strokes. And that brings us to the end. The carotid endarterectomy. You're getting the lining of the carotid artery out of people who tend to have embolisms forming in the carotid. To prevent those. Yeah, everything else looks like we covered. And that is it for the nervous system.